If you thought that cracking INICT was the toughest part, well, choosing a medical specialty is even tougher. Hello everyone, I am Dr. Rishabh Jain. I'm a 2012 batch AIMSonian and I'm currently pursuing senior residency in the Department of Radio Diagnosis at AIMS New Delhi. So I did my PG from PGI Chandigarh in radio diagnosis, and I secured an All India rank 4 in AIMS PG July 18, and a rank 11 in PGI entrance in July 2018. So after securing all these ranks, I was faced with the dilemma कि भाई लाइफ में करना क्या है. हम जब पढ़ते हैं हम तो रैंक के लिए पढ़ते हैं, अब रैंक आ गई तो लेना क्या है. And that was one of the most toughest decision. That was the toughest decision that I have made in my life, because I was aware that whatever branch I choose, it will remain with me for the rest of my life. And so there was sort of a pressure to inside me कि I should not mess this up. And so I based my decision on few points which I'll tell you in this video. So first of all, I'd recommend you, before you choose a specialty, you rule out what you don't want to do, because that is easier. You know what you don't like. So for me, for example, I was sure that I don't want to do psychiatry, derma, medicine or ped. So basically medical branches. I did not want to do them. I was more inclined towards surgical branches and other diagnostic branches like radiology, nuclear medicine, even pathology. I was fine. I wanted to do these. And so after you've ruled out, then I would recommend you to make a table in which you assign your top 3 branches points based on your own criteria. So for example, the first criteria that I would ask you to tell yourself is what you like, because your branch is going to be with you for the rest of your life. And हमारे सीनियर बोलते थे कि आपकी जो ब्रांच होती है वो आपकी बीवी की तरह होती है. कभी कभी आपको उस पर गुस्सा भी आता है, कभी कभी छोड़ने का मन करता है, कभी कभी बहुत प्यार आता है, बट आपको वो निभाना है, आपको हमेशा उसके साथ ही रहना है. एंड सो यू मस्ट डिसाइड at least, so you are whether you are inclined towards surgical fields or whether you are inclined towards medical fields. So that narrows down your possibilities a lot. And if you're someone who likes both surgical and medical field, so then very good branches are ophtha, obs-gynae, ENT, radiology and dermatology. I've kept radiology and dermatology along with little surgical, because radiology has intervention radiology, which has that oomph factor and which will give you that satisfaction of being in an operating theatre. Similarly, dermatology has a lot of dermatosurgical procedures, like they do RF ablations, they do lip corrections and scar removals, and cosmetology has a lot of procedures which give you that intervention feel. So if you're again remember, choose something which you have. If you choose something which you intrinsically like, even the hardships, even the long working hours will not bother you much, because those are short lived, and the happiness that you will get doing well in your branch will exceed all the hardships that you face during that time. Greatness can be achieved in any branch, and money can be made in any branch. I know very famous cardiologists, I know very famous pathologists, I know famous radiologists. And so first thing that you should consider is do what you like and assign similar points. Next, you definitely should consider a work-life balance, because whatever you do after a point, it becomes a little regular, it becomes a little monotonous, and once you're tired for long periods, you want a break to rejuvenate yourself. And so branches like ophtha, derma, nuclear medicine, radiotherapy, ophtha, so these are some branches which have a very good work-life balance. Okay, ophtha not so much if you join AIMS New Delhi ophthalmology, because it's a little hectic. I know residents who are on duty 36 hours, 48 hours straight, and it is primarily because AIMS New Delhi has its own ophthalmology sciences center by the name of Rajendra Prasad Eye Center. And so they require everything pitch perfect, and it's an apex institute, and so it works like an apex institute. Radiology, I would like to touch that your working hours depend on which modality you are posted in. For example, during my residency, if I was posted in X-ray or ultrasound, my usual working hours would be from 9 to 4. But if I was posted in CT or MRI, my usual working hours would go from 9 to 8 or even 9 p.m. And especially intervention radiology, if you are practicing that and if you're posted in intervention IR, then you are on call 24/7, like for 15 days, 16 days straight. So because at any time any stroke can come, any bleeder can come. So within a branch also it depends what you practice. But the good thing about these branches is that post your work, post your job, there is very less to minimal to no patient interaction. आपने सीटी रिपोर्ट किया, MRI रिपोर्ट किया, आप घर जाओ, यू डोंट हैव टू थिंक अबाउट इट. सिमिलरली आप पेट स्कैन रिपोर्ट करो, यू डोंट हैव टू थिंक अबाउट इट. ऑफ्थेल्मोलॉजी में यूजली इलेक्टिव सर्जरीज होती हैं एंड डे केयर सर्जरीज होती हैं. सो डॉक्टर्स सुबह एडमिट करते हैं एंड दे डिस्चार्ज द सेम डे. Many of them keep them overnight. So it also has a very good work-life balance. So next is money. Money is almost similar if you are living in a metro and you are on a salary with plus minus 1 lakh. So I'm talking about radio, gastro, neurosurgery, cardiology, transplant. So it depends. It does not matter very much if you're living in a metro and if you're on a salary, if you're on a payroll. As you become senior, so radiology has this drawback that if you're salaried, your salary does not exceed beyond a certain time, which is not very true if you are, let's say, a very, very, very experienced neurosurgeon, very experienced interventionist. Their salary keep on increasing because then the patient comes by their name and they generate revenue for the hospital or themselves. Intervention branch in general have more money as compared to non-intervention branch, but even in non-intervention branch, if you open your small setup, and which is possible in non-intervention branches, then you can make decent and very good amount of money. So this is the average salary which I've quoted from Delhi. In Delhi, post MD, so radiologist here typically gets around 2 lakhs per month. An obs gynae, a gynecologist post his or her MD gets around 1.3 to 1.5 lakhs per month, and if you're just an MD medicine or MDP, the salary will range from 1 to 1.3 lakhs per month. This is just post MD without SRship, without any DM. But obviously, if you do a DM, then your salaries would increase. Similarly for MCH. So next, I have written down whether your branch has a mandatory need for SRship or a DM. So most surgical branches, especially in central institutes like AIMS, even PGI, they do not give much hands-on during the residency. And hence doing an SRship becomes a mandatory requirement. अगर आप एम्स या पीजीआई में जनरल सर्जरी कर रहे होगे तो आपको SRship करनी ही पड़ेगी. And even if you're doing a medical specialty, let's say for example dermatology or radiology, most people do at least 1 year of SRship. It's not mandatory, it's not required. उसके बिना भी अब लोग practice करते हैं and they're doing very well. But most people do at least 1 year of SRship. So next is the DM tag. लोगों को एक DM tag से बहुत लगाव होता है कि बड़े डॉक्टर हैं, DM है, बड़े डॉक्टर हैं. अगर if you are someone who likes that oomph and that DM tag wala chord, so go ahead, definitely take a branch which has a MCH or DM. I'd like to remind you that many of us don't know that there are DM in branches like radio, pathology, nuclear medicine and orthopedics also. So for example, in radiology there is DM in neuroradiology and cardiac radiology and intervention radiology. In pathology there is DM in hematopathology. Nuclear medicine there is DM in therapeutic nuclear medicine. In orthopedics there is MCH in spine surgery in AIMS Rishikesh. So next factor you should consider is how much do you like or love patient interaction. If you are someone जिनको बहुत खुशी मिलती है कि patient उनको thank you बोल के जाए, पैर छू के जाए, so clinical branch is for you. In general, litigation is something you should worry about before choosing a specialty, and which is more in surgical as compared to non-surgical branches, that is for sure. Similarly, recent there has been a menace कि पेशेंट के रिलेटिव्स आएंगे, चीखेंगे, चिल्लाएंगे, थप्पड़ मारेंगे, तोड़ा फोड़ी करेंगे. This is a new occupational hazard which you should definitely consider before you take a PG specialty, and this is definitely more in surgical branches and branches will deal with emergency like obs, gynae, surgery, emergency medicine. Next is academics. If you are someone who is deep into academics, who likes doing research, then medical field offer more time, more opportunity than surgical field, because surgical field by virtue of the practice offer you less time. So वहाँ पर research की भी कम ही opportunities आपको मिल पाती हैं. Radiopathology are very good branches if you are into academics and you want to go into academics, because they deal from head to toe, and all specialities need backup of radiology and pathology. So based on this, I'd recommend you that you make a roster point and you assign points to each of the branches that you've shortlisted. जिसमें भी ज़्यादा point हो, choose that. Simple. दूसरा, what you can do is before your counseling start, attend clinics. So if you are inclined towards the surgical branch, attend the surgical rounds in the hospital, go to surgical OTs, see whether you like कि ये मैं कर सकता हूँ for the rest of my life. Similarly, if you are choosing a medical specialty, attend the rounds in the wards, go to OPD, sit with the consultant. No consultant refuses कि आओ हमारे साथ क्यों बैठे हो. If you want to choose radiology, come to radiology reporting rooms, attend clinical radiological conferences. All consultants will be happy to let you in and have a hang of radiology. You can also read the main textbook of that subject, that कि मुझे boring तो नहीं लग रहा है ये सब पढ़ना. And at the end, I would like to tell you that whatever you decide to choose, stick with it, because there will be times in your residency when you hate your job, when you will actually repulsed by what you are doing, but it will be temporary. And as I said, that your branch is like your spouse. You have to tolerate both the good and bad things about it. So good luck, and feel free to contact me if you have any queries. Thank you.